Back. As Democrats in Congress take the health care debate to their home states this month, the message from the White House is clear. The Democratic infighting has to stop. This week, White House Chief of Staff Rahm Emanuel warned liberal groups to stop attacking blue dogs in health care ads. Meanwhile, President Obama told Democratic senators that he didn't like liberal groups spending advertising dollars to take aim at congressional Democrats. Joining me now, Democratic Congressman Engel. He serves on the House Energy and Commerce Committee. He represents New York City. Congressman Engel, let's take a look at an ad that MoveOn.org is running about one of your colleagues on the Energy and Commerce Committee.
Today in Georgia, a patient lost insurance coverage for medical care she needs.
Hospital bills will eat up another family's savings.
And a small business owner is worried about affording health benefits for his employees.
But when Congressman John Barrow recently had a chance to help fix our healthcare crisis, he voted no. Instead of helping Georgia families get more affordable, quality healthcare choices, Congressman Barrow sided with the special interests and insurance companies.
Congressman Engel, is that helpful to the process?
Well, I'm on that committee, and I voted yes, but I don't agree with the ad. I don't think it's particularly helpful to the process. We have a lot of work ahead of us to show the American public why we need health care reform. And we do, and we can make the case. 47 million Americans without any kind of health coverage, people denied coverage because of pre-existing conditions, and co-payments and the cost of health care premiums has risen way, way beyond the rate of inflation. So we should be concentrating on that, on convincing the public that we need health care reform. I don't particularly think an ad like this is very helpful.
Now, you and John Barrow have very different districts. You represent a section of New York City. He's represents a district in Georgia. What do you think about his no vote on that bill in the Energy and Commerce Committee? What do you think motivated it?
Well, I know John Barrow. He's a good member of Congress, and we're friends. We disagree on this particular issue. I did not like that the 7 blue dogs, in essence, held the bill hostage till they got what they wanted. But, you know, they're only doing what I do. They're only fighting for their constituents, for what they believe. It may be different from what I believe, but they're fighting the good fight.
Are they fighting for their campaign contributors?
Well, I can't say what they're fighting for. All I know is that I'm fighting for health care reform because the American public desperately needs it. We all need it. The current system is unsustainable, and the Republicans are wreaking havoc throughout the country, disrupting town hall meetings with orchestration, with right out of the playbook. And we need to convince the public that health care as it currently is not sustainable, and therefore we need reform. And I think President Obama is doing the right thing and a good thing by going around the country spreading his message, and that's what I'm trying to do.
Congressman, are you getting any pushback from your constituents on what you voted on so far and what Charlie Rangel's committee has delivered, which includes 3 new top tax brackets? That revenue would be taken disproportionately from New York City compared to other areas of the country. So I can imagine that there's a certain pressure on you about some of the things that are in this bill already.
Well, look, no bill is perfect, but what we are doing out of the Energy and Commerce Committee and the 3 bills that are now have now passed committees, we are trying to reform health care. People think that the current health care is just sustainable. They can continue a year from now, 5 years from now, to have the same health care. And what we're saying is, no, it's not sustainable. Premiums are going to rise. More people are going to be uninsured. More people are going to be denied coverage. If you lose your job or change jobs, you're going to find that you have no coverage. So we're trying to reform it to make sure that the American people have the kind of coverage we need and deserve. There's a lot of confusion out there. What I'm getting from my constituents is people are asking questions. People want to be able to keep the health care they have now, and that's what this does. If you like your health care, as the President has said, you can keep it. You can keep your doctor. We just want to make sure that hospital emergency rooms aren't being used, continuing to be used to give so many people primary health care. The system is broken, and we need to fix it. And the Democrats have a plan to fix it. Republicans have a plan to disrupt town hall meetings and to be negative and to just say no. It's the same party that voted against Medicare and Medicaid back in the 1960s. So we have a positive plan. We think that when the public knows the plan, they will support it. And Charlie Rangel's idea was to get some revenue from the top brackets, people who are millionaires, who are making $1 million or more per year. If that happens to fall disproportionately on New York City, I'm glad people in New York City can afford to do that. But we're not looking to tax middle-income people or people that can't afford it. If we have any money for this bill, any kind of taxing will go only to people making $1 million or more a year, and I think that's fair.
Congressman Elliot Engel, thank you very much for joining us on The Ed Show.
Thank you. It's my pleasure.